Hi, everyone. My name is Shin. I use she, her pronouns, and I am the Oregon Community Food Systems Network Coordinator. And I'm here today co-hosting with Kaylee Summers and Michelle Rose, who are both the Veggie RX Working Group co-facilitators. And I know we had a little bit of a change in scheduling for today, so we're focused on just doing a pretty casual open house today. And just in terms of like top level agenda, I'm going to start off with a few quick updates for like the overall network, some upcoming events, and then we'll pop over to Kaylee, who's going to give us a quick 5-minute overview of just like CCOs and some other things that might help frame the conversation with the team from ORBRN, which is the Oregon Rural Practice-Based Research Network. We have a speaker from the team coming over. I can't tell if you're on the call yet. And then we'll open it up for questions. And thank you, Claire. I saw a little hand raise. And yeah, and then we'll open it up to questions for Claire. And then if folks have questions in general for the Veggie RX program, that would be great. And I think while I give some quick network updates, if y'all can drop into the meeting chat, your name, your pronouns, your organization, as well as whether or not you're new to this group. Or if you've been participating with the Veggie RX working group for some time, let us know when you started when you joined this community. And then, all right, so in terms of quick OCFSN updates, so in 2022, we started doing regional convenings. And so our first one for 2023 is going to be up in Astoria on the North Coast. And that's going to take place in April. Yeah, and that will be focused more on food hubs, but all are welcome. And so there will be a registration info coming out next week. And then we also have some updated, we have an updated Google group. So if you're on this call and you're not currently part of the Veggie RX Google group, that's kind of what we use for our email listserv. And so what you can do is, I'm going to drop it into the chat. But you can essentially email veggie-rx plus subscribe at ocfss.org to automatically add yourself to the group. And I think the final quick update I will give is we'll be sending out an email today with the updated agenda, but the Veggie RX mini convening was pushed back to March 3rd. So that will require a registration. And we're really looking forward to seeing hopefully most, if not all of you in a few weeks. So I will drop all of that info in the chat and I'll pass it over to Kaylee.
Awesome. Thank you, Shin. Hi, my name is Kaylee Summers. I am co-facilitating this working group with Michelle Rose, who's on the call today too. And we are so excited to have Christina and Claire from the Oregon Rural Practice-Based Research Network today to give a little bit more information about the 1115 waiver. And if 1115 waiver is like, wait, what the heck are you talking about? I'm gonna give a very high level overview just so that we're kind of all on the same page when Christina and Claire are presenting today. So essentially, there is a thing called Medicaid and Medicare that you might know about. And the way that I like to think about these is Medicare is for elderly population, and we care for our elders. It's not that we don't care about everybody else, but when you're a working family and maybe you have the Oregon Health Plan, which is also sometimes called Obamacare or Medicaid, You may be a non-elderly population, but eligible for aid as your medical insurance coverage if you don't have private insurance. So that's kind of how I try to distinguish between those two. And the 1115 waiver, we're talking about, actually, let me step back a second. So there is federal funds that fund Medicaid. And for each state, they implement their Medicaid a little bit differently. In Oregon, we have CCOs, or coordinated care organizations, that manage those funds through OHA. So OHA is getting those federal funds. Those are going off to CCOs to manage care, much like a private insurance company for a private plan. And please, for folks who are maybe working within CCOs or have more information about this, if I'm botching this, you're welcome to stop me at any time, but this is how my brain kind of connects the dots. So there's the Center for Medicaid Services at the federal level, and then on the state level, we have in Oregon expanded Medicaid, and we use coordinated care organizations. And in other states, they also have, sometimes they may call them not CCOs, but they might ACOs, like associated care organizations. There's different terms that they use for those. So in Oregon, though, you can think of this as like Care Oregon, All Care, Eastern Oregon CCO. There's different names, and we have about 12 of them in Oregon that cover different regions. And some of those CCOs overlap. So for Multnomah County and the Tri-County area, there are multiple CCOs that will cover members, members being patients, Medicaid patients, or OHP members, Oregon Health Plan members. And with expanded Medicaid, states have the ability to submit waivers so that they can cover more services, including things like basic need services or social supports. So this 1115 waiver that Oregon submitted to CMS on the federal level asked for more support for things like housing and food supports. And we just found out, well, several months ago now, but it seems like a very recent update, that the federal government, the CMS department, said, yes, we will grant you this 1115 waiver, which then pumps more funding to support housing and food supports for specific populations within that are covered by Medicaid in Oregon. And that's where Christina and Claire are going to go into more detail on what that means and how this might connect to Veggie RX programs, which is what we're talking about today. For the mini convening, we will be talking more about the 1115 waiver, but I think it's important just to recognize that there's a lot of different funding mechanisms that can come from CCOs, the healthcare world, and that we just decided to highlight this one today. But there are different ways that programs have accessed funding in different ways to support Veggie RX or food prescription and food supports for their patients. Christina and Claire, like I said before, are working with the Oregon Rural Practice-Based Research Network, and that's a statewide network of primary care clinicians, community partners, and academics dedicated to studying the delivery of healthcare, improving health for Oregonians, and reducing rural health disparities. And ORPRN has been key at bringing together CCOs around the state to understand the 1115 waiver and how that's going to be eventually implemented. But for now, I will pass it over to Christina and Claire to give us more explanation there. And certainly we'll have plenty of time for discussion and questions after. And you can put those in the chat meanwhile, and I'll keep track of those. So Christina and Claire, you can focus on your presentation and I'll bring up those questions.
Okay, sounds good. Thank you so much, Kaylee. We also incorporated a slide's worth of information about Medicaid generally and how this waiver connects. I think your summary might have been more succinct than ours, but so we'll repeat some of that just for extra knowledge for everyone. Yeah, I think we're probably ready to share this slide deck, Shin, if you have it up. Thank you.
All right.
Awesome. So as Kaylee mentioned, my name is Claire Londigan, and I'm a research project coordinator with the Oregon Rural Practice-Based Research Network, or ORPRN. And Christina here with me is also a research project coordinator with ORPRN. ORPRN is located within OHSU. We're a research institution within OHSU. And Christina is very well versed in those kind of CCO conversations. So I think she'll have maybe some interesting insights for the Q&A opportunity at the end. Also, yeah, feel free to pop questions into the chat as we go. So we're just going to be talking about some details on the current 1115 waiver demonstration in Oregon, and a little bit of insights from our outreach with CCOs. You can go to the next slide, please. Thank you. So first, we wanted to give a brief overview of how Medicaid works in Oregon, and how the waiver fits into that. So Medicaid is both a state and federal program and delivers healthcare to people who have low incomes. In the state of Oregon, Medicaid members and services are managed by those CCOs, those coordinated care organizations, and they provide services regionally. Actually, it would have been great to include a little CCO map, but maybe for our next presentation about this, we'll do that. And then every 5 years, Oregon has to apply for this waiver to expand some of the federal Medicaid rules that allow us to make changes from normal federal guidelines and expand who is covered by the Oregon Health Plan or Medicaid plan, and as well as pay for healthcare a bit differently and implement other reforms on a state level. So this current waiver was approved, I believe, in October for the next 5-year demonstration period. And it allows the state to use those Medicaid federal dollars for health-related social needs benefits, or HRSN benefits, such as food and nutrition supports and housing for specific populations who are in transition. So the coordinated care organizations, those orgs that provide Medicaid services in the state, are also required or incentivized to provide health-related social needs benefits in other ways. And so some of those HRSN benefit funds that already exist and are already leveraged for nutrition and food security programs, such as some Veggie RXs in the state, are share dollars and HRS dollars. And I'll give a really high-level overview of those in a few minutes. But there's also live links in the slide deck that I think Kaylee can send out after to find out just, again, pretty high level, but a little bit more about those other kind of CCO Medicaid-related funding streams for food and nutrition programs. And as Kaylee mentioned, Oregon Health Authority directs and implements all of these programs. You can hop to the next slide. So as I mentioned, the current 1115 waiver allows spending on those health-related social needs for specific populations. And the benefits, the HRSN benefits under this waiver are approved for these populations only, and they're referred to as transition populations in the waiver. So these include youth with special healthcare needs, ages 19 to 26, adults and youth discharged from an institute for mental disease, carceral populations upon release, youth involved in the child welfare system and transitioning out of foster care, individuals transitioning from Medicaid only to dual eligibility status, which I don't need to get into the details of that one, individuals who are homeless or at risk of becoming homeless, as defined by HUD. Individuals with high-risk clinical healthcare need who reside in a region that is experiencing extreme weather events as declared by the federal government or the governor of Oregon. So things such as wildfires, especially in our state. You can hop to the next slide. So in order for folks to be eligible for the health-related social needs services, members must be from an aforementioned approved transition population and have a documented need for the services based on a screening questionnaire that's implemented at some point either at a clinical or CCO or potentially other location. So in the context of this program, health-related social needs services do not need to be tied to a clinical diagnosis, for example, diabetes mellitus, but the services do need to be deemed medically appropriate based on clinical and social risk factors. And then that determination has to be documented somehow in the Oregon Health Plan member or the patient's care plan or medical record. Next slide, please. So listed here is the food kind of benefit for the transition populations as is defined in the current 1115 waiver demonstration specifications, which include nutrition and cooking education, fruit and vegetable prescriptions, meals or healthy food boxes for pregnant members, children, and youth with special healthcare needs, medically tailored meal delivery, and navigation or case management for community-based food resources, such as application support for SNAP or WIC. And more specific definitions and implementation planning is forthcoming from Oregon Health Authority. At this stage, there's a lot of questions that remain about the implementation of services, and the benefit doesn't begin, or it's not set to begin until next January 2024. So there's a lot that's left to be released about further details about the kind of benefit resources themselves. You can hop to the next slide. Thanks. And so again, kind of as Kaylee mentioned, there are these other health-related social needs funding streams from CCOs and kind of the Medicaid system overall in Oregon. And so I wanted to share just a really brief overview. Our team at ORPRN, not Christina or I, do work on some of these other programs as far as technical assistance to CCOs related to the health-related services and the SHARE program. So I'll start with the SHARE initiative. And it comes from a legislative requirement for coordinated care organizations to invest some of their profits back into their communities. After meeting minimum financial standards, CCOs have to spend a portion of their net income or reserves on services to address health inequities and the social determinants of health and equity. And this money is often reinvested through mini grant programs or other kind of community programs. Share dollars are required to be used as CCOs consult with the communities that they're located in. So it's definitely a very community-based process. And then below that one on our slide here, we have health-related services, which are non-covered services, so kind of non-medical services that are offered as a supplement to covered traditional medical benefits under Oregon's Medicaid state plan. And it's intended to improve care delivery and overall member and community health and well-being. And they include flexible services, which are cost-effective services offered to an individual member to supplement covered benefits, and community benefit initiatives, which are community-level interventions focused on improving population health and healthcare quality. And again, the community benefit initiatives include Oregon Health Plan, those Medicaid members, but are not necessarily limited to members. And some Veggie RX in the state are leveraging the health-related services funds already with their regional CCOs. And so as far as what we know so far about how the 1115 waiver will intersect with these, health-related services will continue to exist similar to how it does now with the exception that if someone qualifies for the 1115 waiver, health-related social need benefit, the CCO will need to cover it as an encounter, not as health-related services. So if someone doesn't qualify for the 1115 waiver HRSN benefit, it will continue to be allowed through health-related services, given the rules and requirements of that separate funding. So just in summary, the health-related services and the 1115 waiver can't be combined for services of a single patient, because the eligibility is a bit different. And the way that that's going to work, or if one is going to supersede another, or screening requirements, et cetera, is kind of yet to be determined. But there's a lot of interest, I think, from everyone involved about how those two funding streams are going to overlap or dovetail, and the limitations there. But that's what we know so far. And then there is also a new statewide metric, the social determinants of health screening and referral metric, that will also begin rollout in 2024. And so this will require CCOs to screen their members for food, housing, and transportation needs, and establish written agreements with community-based organizations who provide those services, and then refer Medicaid and Oregon Health Plan members to these resources. And the planning and implementation for this measure is also still in progress, but there is a lot of potential overlap with the 1115 waiver food and housing services and screening processes as well. And so feel free to reach out to us. We have some contacts at the end of this slide deck, or just to Christina in my emails. If you want more information about technical assistance opportunities related to that measure as well. And then there's a live link on this slide related to that measure too. Yes, thank you. So we at the Oregon Rural Practice-Based Research Network have been convening CCO work groups bi-weekly for the past 6 months to solicit feedback about the 1115 waiver to inform the implementation process and the key decisions that need to be made. And so feedback from CCOs was synthesized by our team and delivered back to OHA as part of that. And Kaylee and other community-based organization representatives did participate in some of these work groups as well. There were a total of 11 work group sessions. 9 of those sessions were presentations and discussions. And some topics included an overview of what was submitted in the waiver application and what was approved. The CCO current methods to identify populations, screen and do referrals, and collect data, especially barriers and concerns with the concept of the 1115 waiver. Pre-existing CCO programs that support these transition populations already, the best practices related to food and housing programs, and the concept of the 1115 waiver. And during the final 2 sessions, CCOs presented about food and housing programs that they already have in place. You can hop to the next slide. Thank you. So most CCOs are at the very beginning stage of benefit and implementation planning, as is Oregon Health Authority, for the 1115 waiver health-related social needs benefit. Health Share, the CCO, has made some significant progress in terms of piloting housing, but most other CCOs are really at that beginning stage at this point. I did think it was maybe worth sharing that CCOs are currently screening for food insecurity, and they connect members to services through health risk assessments, primary care providers, so in a clinical setting, community information exchange, so CIE, which I'll talk about in a minute, school districts, community health workers and traditional health workers, care coordinators, and investments in programs such as Veggie RX, Double Up Food Bucks, food banks, and culturally specific community-based organizations, CSA products, Meals on Wheels, etc. So numerous CCOs have already invested in produce prescription programs or Veggie RX programs and are aware of the specific call out of produce prescription programs in the waiver. And so they're aware of the regional variation and seasonality of these programs overall. And so looking at the 1115 waiver health-related social needs benefit and other health-related social needs services through those CCO's funding streams, as I talked about a minute ago, we recommend getting connected to a community information exchange platform if you aren't already, which at this point, the ones that are used by CCOs presently are United Way or Connect Oregon. Sorry, Unite Us or Connect Oregon, different thing than United Way. I misspeak there. Or Aunt Bertha, which if you're in Clackamas, Klamath, Lane, Multnomah, and Washington counties, Aunt Bertha kind of connects that way in those regions, and it's active in those regions. And community information exchange is really not quite a referral platform at this point, but it is a way for CCOs and providers and the referral network to connect with community-based organizations that provide services. Community information exchange will also be leveraged for the social determinants of health and screening metric, which is the statewide metric that's also rolling out next year. And that's definitely a way to begin to get connected to these systems as the implementation kind of continues to be developed. I would also mention something that we've heard in our outreach in the last 6 months, finding creative ways to extend Veggie RX programming or other food access programming and nutrition security programming to be for a longer term or more year round might make that programming more compatible with CCO and state organized health related social needs services and funding streams. And again, as I mentioned, OHA is really currently working on defining the 1115 waiver food and housing benefit for those transition populations and the implementation plan. So there's lots more information to come. You can hop to the next slide. And actually, we can stop sharing the presentation so we can all see each other's faces, but we're happy to answer questions to the best of our ability or bring things back to our team and get back to the group by email. We definitely have some very high level expertise at how all of these programs integrate. Yes, CIE is Community Information Exchange. And I see there's a number of questions in the chat.
So some folks were asking if the presentations will be shared, and I believe that Shin just shared those. There's a link that she put in there, and that was, and then the CIE were the two that, and then, but it looks like Juliet, you've got your hand up.
Yeah, Claire, you mentioned that, excuse me, expanding programs might make them more compatible to in terms of fitting the requirements. But then I saw on the slide that it said 6 months somewhere. Can you just talk a little bit more about that?
Yes, so in the waiver specifications, the food benefit is, or the health related social needs benefit, the food element is available for kind of 6 months, and it is not been defined yet if that's 6 months consecutively. But yeah, I think I can't speak more to that because I don't know what the OHA implementation and decision will be around how that's more closely defined. But since that is how it's outlined in the waiver, it has come up as an area of interest for CCOs and for programs that are maybe not available year round.
Can I also jump in here maybe to clarify but also that transition populations and these benefits aren't going to necessarily start on January 1 of every year or a fiscal year. And so by having a year-round program available, once that patient or that member is identified, they could be identified as needing that food support in March of a year or in October. And so if that benefit is available year round, then they, and if it's a consecutive 6 months, they can start whatever time of year that they might need. Am I interpreting that correctly?
Yes, definitely. Thank you for that clarification, Kaylee. Yeah, so for example, if someone is released from a carceral, population situation at any time of the year and they need to get connected to resources and they're eligible. But for example, if there's a seasonal food program, it might not work if they need it for 6 months, and they can receive those benefits for 6 months. But again, there's needs to be more clear definition for implementation at this point.
I guess my question is coming from a place of like, do we need to start considering adjustment for 2024? Currently, folks can use their debit cards for 6 months in our program and they can be referred to the program any time of the year, but enrollment only happens before that 6-month period. So that's where my question's coming from. It sounds like it's not clear enough yet, but yeah, definitely be interested if we need to. It's going to be the reason we don't have rolling enrollment at this point is because it's obviously a lot more challenging. So we need like to know if that's something we need to do. And
yeah, definitely. And I think that just yeah, there's more information needed from the state there, but it was worth mentioning because it's something we heard from the kind of CCO community, and that it came up as far as food or housing programs that are not currently available.
thanks, Claire.
And I just want to reiterate that question, Juliet. I think that's an amazing question, and something that as we put these things on our radar of what CCOs are looking for as program operators, those are the type of questions that we need to be asking of, like, how do we need to adapt our programs in order to fit the needs of and the possibilities of expansion through this, right? And so like you said, Juliet, like this is something that you'd need to think through, not just with 1 month's notice, but this is like, if we're thinking about this for 2024, how could that be integrated into your program model?
Yeah, exactly. Thanks, Kaylee.
We are also happy to answer questions as they come up by email. If things come up for folks after the presentation, or even after the rescheduled convening in a couple weeks.
Can you either of you talk a little bit about next steps? I know that you said, there were these different meetings, working group meetings with CCOs, and there were 11 total, and that those recommendations now ORPRN has taken back to OHA. There's some things happening there. Can you give us a sense of what those next steps are? And also another question to that, like, how is OHA or ORPRN engaging with CBOs to figure out how to meet the demand for both food and housing supports?
Yeah, those are really great questions. And I think we don't know for both of the answers. They're really still in the planning and implementation planning process internally. And so, yeah, I think CCOs are also waiting to hear back on some of those elements for their own implementation. Yeah, so we don't know yet. There's a pause at this point and kind of waiting to hear back. Yeah.
So Carrie had a question about how would local producers connect with our local CCO to provide those the fresh produce through VeggieRx programs?
Yeah, that's a really good question. And we thought about kind of including a slide, but as it pertains to the 1115 waiver, I think CCOs really aren't ready yet because those benefits haven't been defined by the state yet, and that's all in process. So we would be happy to come back to a future convening or meeting, maybe in 6 months from now or in the fall, as far as, you know, seeing if we have more resources as far as connections, to connect with your CCO as that's in your region as far as health related services, or kind of accessing potentially some of those other funding streams to meet the needs of that CCO's community, and their, you know, social determinants of health and equity efforts. There are definitely other Veggie RX programs that are already doing that, I think potentially in your network. So that might be a good place to say, you know, how did you start with, you know, this unique programming? But we can also go back to our team. We have a team that works on those health related services and in lieu of services specifically. And we can ask, you know, if there might be what the best route or contact would be for that. But for the 1115 waiver at this point, I think CCOs aren't ready to start that process.
And I think that's a great question. You know, OCFSN, we're trying to track sort of the development of this 1115 waiver. That's why we brought Claire and Christina on today, to keep in contact with ORPRN and continuing to involve CCOs on these OCFSN conversations in the Veggie RX network. Are there other ways, like, does ORPRN have a newsletter that people could sign up for? Or does OHA have a newsletter that would give updates about this process so that people like maybe Carrie, who's got a food hub that, you know, could just track this? And I think maybe back to Juliet's question too, these things take a lot of planning, and farming is seasonal, and crop planning and trying to figure out like who is the audience and who's this food getting delivered to often takes time. It's not just within a week, you know, trying to push things out. So some of that advanced planning, how do we stay in the loop of what's coming down?
Yeah, that's a great question. Yeah, ORPRN definitely has a newsletter. A lot of the content is very clinician focused and not so much on the health policy side of things. So I'm not sure how relevant it would be for folks. OHA there is a newsletter that might be relevant. And I know it's mostly distributed to CCOs, but I can reach out to our contacts and see if it would be appropriate for community-based organizations as well, because that would be, or if, you know, that's part of their desired audience to send the newsletter out to community-based organizations, because it definitely would have more updates about these kind of this health policy and social determinants of health and equity efforts. So I can reach out and see if that newsletter is something that would be relevant for y'all, and send that maybe Kaylee's way. And then we also, we do have some upcoming webinars that we would love community-based organizations to attend, but they're not about the 1115 waiver. They're about some of these other funding streams. So I can, again, send those to Kaylee or Shin, and get those on y'all's radar.
Yes, please do, Claire.
Okay, great.
Yeah, that would be fantastic. I think that even that slide that you had with the 4 boxes, like, woo, that was very informative to hear about that. And I know that a lot of programs are trying to figure out ways to diversify funding. Oftentimes, historically, these programs have been funded through grants, which aren't the most sustainable forms of funding. So having other outlets of figuring out how to fund this over the long term is really important. I'm also wondering, I'm sorry, I know I'm dominating the questions, but I'm hoping to kind of, that these might be floating around in other people's minds. I know that you all are closely connected with CCOs. would it be appropriate for an individual program that isn't yet connected with their CCO or doesn't quite know who to reach out to, if they are able to reach out to you to say, we really want to partner with our CCO, do you have a specific contact that we can reach from that, from our regional CCO?
Yeah, I think that's a good question. And I'm honestly not totally sure of the answer. I would bring that back to my team. I think the short answer is probably yes, but yeah, I can I'll ask Anne King.
Thanks, Claire. There's a question here from Amber. Is there an info share between the different states that have 1115 waivers, or are the programs pretty tailored to the individual states?
That's a good question. Christina, do you have an answer to that off the top of your head?
I do not, unfortunately. Do you, Claire, have an idea?
Yeah, I think I'll only speak to what I know and just say I don't know. I think I have a half-formed answer, but I don't know. And I don't think that there is that kind of share between states, or a formal network of that information sharing between states as far as the 1115 waiver. And I think there is, because the state of Oregon did apply for kind of our specific programming, I think there is some level of it being tailored to each state, or at least significant differences between waivers across.
I believe it was pretty innovative, like the very first waiver to cover housing and food supports in such a massive way for Oregon. Like that was big national news, that Oregon was awarded that waiver to cover those specific social determinants of health needs and basic needs in that way. Also, if you're just like an individual and you have OHP, how do you know who your CCO is? Is that on your health card? Like how do you, or is there a map on OHA's web page that shows who's covered by what, or who is covering your region?
Yeah, there is a map like that on OHA's webpage that is just very helpful for reference. As I said, I should have included that in the slide deck, because I think for folks who aren't thinking about CCOs, you wouldn't know. So yes, that exists. As far as members knowing who their CCO is, yes, it's on their card, on their kind of insurance card, and pretty sure it's standardized across the state. They get lots of mailed information and pamphlets, and there might even be other folks on the call who have more awareness of that if you're working with CCOs at all, and other health related social needs capacities. But yes, so it's kind of mail direct outreach, and it is on that card.
Carla, did that answer your question too? Okay, cool. Any other questions that folks have, or insights that, like, things that are floating around that maybe aren't fully formed into questions that you want to share with the group? Oh, great. Thanks, Christina. Christina just popped in the chat the link to that CCO service area map, so you can look in your region for that.
Yeah, and if you do click on that, you'll see that EOCCO is Eastern Oregon Coordinated Care Organization covers pretty much all of the frontier counties in the state. And so, yeah, they have a pretty huge reach. And EOCCO is doing a lot of interesting work as far as screening and connecting folks to resources. So I think there might be, actually, this is just from my previous experience attending some of these meetings as a graduate student, but is there a VeggieRx program that's closely connected to EOCCO? Yeah, there is. That's what I thought. Yeah.
Yeah, Marcy McMurphy isn't on the call today, but and actually Lindsay is on, but is now working for OFB, but works with EECO or EC, sorry.
EOCCO.
Thank you.
Why are there so many acronyms?
Yes, it can be very confusing. And same names for the same or different names for the same thing sometimes, like when we're talking about referring to Oregon Health Plan, OHP, Obamacare, Medicaid, it gets quite confusing. Yeah. Well, thank you so much, Claire and Christina, for hopping on today. And we hope that this isn't the last conversation we'll have with you. Really excited. Like you said, Claire had joined us in previous meetings with the VeggieRx team as a grad student. And so we're really excited that you could come back then with this helpful information to the group and already have some context for what we've been working on as a network as well. With some time here, I would love, oh yeah, and finding contact information for Claire and Christina, I think we can pop that in and then when we share out the slides via the listserv from this meeting, we can include their contact there too.
Yeah, our contacts are in the slides, as well as Ann King, who is the kind of director of our program. And she has a really excellent high-level knowledge of how all of the different social determinants of health programs from CCOs intersect. So yeah, feel free to reach out to any of us or reach out to me and I can direct your question to the right folks.
Thank you. And we wanted to celebrate because I think we were actually talking to a representative from a CCO from AllCare earlier today and talking about the importance of partnerships. And I wanted to invite Juliet to share some good wins with your partnership with the CCO in your region.
Hey, hi everyone. So I'm Juliet. I run the VeggieRx Umpqua program here in the Umpqua Valley, the Roseburg, kind of Douglas County area, and we're going into our 5th year now in 2023. And our CCO has been really supportive of this program for the last few years, but it's definitely taken a whole new form in 2023 where they've stepped up in a huge way and are committing up to $100,000 to support our program this year. And so that's going to cover at least 20 participants per clinic partner, as well as their clinic kind of participation fee, which includes some of you may be aware about our partnership with About Fresh or the Fresh Connect platforms. That's going to cover that cost. But they're also taking another step and reimbursing our clinics for the out-of-pocket expenses that they committed in 2022. So they're just really alleviating the burden of costs on our clinic partners, and it's an amazing investment in this program, and we're really excited. I also wanted to mention that there's not a lot of conditions on these funds, but one condition is that the referral to the program is made through our CIE, which is Unitas. So Claire, you had mentioned that. So it's going to be our first time using that platform in this way and getting folks just kind of acclimated and accustomed to using that and supporting the program in that way. So we're really excited about that. And just a few things about our program thus far. It started with an 8-week pilot program, 1 provider, 1 clinic, and every year it grows a little bit. So for anyone that's on the call and thinking you might want to try it out, I really encourage you to just start really small and test out your flow and your processes and your partnerships, and and 1 redemption site, which was our farmers market. So that's all ground now, and we've served 446 households through 2022. And we see great outcomes. We've had 769 pounds lost by participants over the years. Of course, a decrease in food insecurity. Yeah, folks, of course, seeing an increase in fruits and vegetable consumption as a result of the program. So yeah, I'll just stop there and just wanted to share a little bit of that good news. And I also want to just give a little shout out to Brandy Gardner, who's on the call today, who really helped facilitate that process with us getting that funding. So really grateful to Brandy for making that happen.
That is so fantastic. Thank you, Julia. And thank you for mentioning that you don't have to start out big, right? Like these things can take baby steps to start implementing. And oftentimes that's how they are most successful, by figuring out how much capacity you have, starting with that, and then growing from there, and that you can find great supporters and partners. So thanks, Brandy, for being a champion too in your CCO and for this program as well. Yay. Wonderful. Well, anyone else have any other things that they want to celebrate or questions or anything for the group?
Yeah, I'll say something.
Jen, hi.
Sorry, my light's kind of weird. That's why my camera's been off. But so I am working with OCFSN as a contractor to help with the GusNIP grant. And what's due on Monday is a support grant for capacity building and innovation fund. And so I've been working on that, and we're almost done kind of with like a budget, and it's only like a few questions, but I'll be putting out like a little draft if anyone wants to have eyes on that also. So I know that we're going to be budgeting for a grant writer specifically, and then it's more on like strategic planning and kind of getting almost like paying everybody that's doing already the work, like the working groups and things like that. So that's what we're going for. So hopefully we'll get that. We'll know by the end of the month. So.
And it was unfortunately a very tight turnaround. So really excited that we have Jen to help support pulling that together, and then hopefully paying for the time to convene folks, and hopefully in person too. And then the other piece of update is we don't yet know exactly when the actual GusNIP grant that we will apply for is due. So TBD on that.
Yeah, but I had a meeting with somebody that works with the supportive grant and capacity building grant, and she said that because OCFSN is kind of a new nonprofit technically, that as like a statewide network and trying to do the work that we're already doing, it sounded like we had a pretty good shot of getting it. So positive news.
That would be exciting. And Jen, I know you were trying to kind of scope out too if there were other organizations in the state that were also applying for GusNIP, like the larger GusNIP funding. So if you, in your organization, anyone on this call, or know of other folks in other organizations that are planning on going for that funding, I'm sure Jen would love to hear from you to kind of figure out, like, we don't want to compete with other organizations necessarily, but how can we partner? And also just kind of understanding what the funding like scope is for the state and the different organizations that are anticipating submitting applications for that. Great.
I have something to share. I can hear my voice because Maida's sitting right next to me. So Maida and I have something to share. We actually just submitted a proposal to our CCO. And remember, I'm still learning so much. It's crazy. This has been such a very, very informative and amazing meeting. But the news is that we submitted a proposal to CARE Oregon for more funds. They actually asked us to. They said that we are the least funded CBO, and they were like, please send us what you want. And so we actually requested, we are paying right now, we are funding our participants $6 a week per family member, and we bumped it up to 10. So we're hoping that this will be a really, really great year for them. And then also they actually have funds specific for uninsured. So they were only supporting us for our people who are on the Oregon, who have the flex funds on the Oregon plan, but they're also going to be giving us some funding for our uninsured participants. So really great.
That makes me particularly happy. I'm happy for everybody, but I'm so glad to hear that, Carla and Maida. Congratulations.
Thank you.
And I should say, if you don't know me in previous, I say that because I used to work for Adelante Mujeres and work on Carla and Maida's team for this specific program. So it warms my heart to see that these programs are being sustained and that there is more engagement with CCOs and different partners and realizing the investment that they need to make to sustain those and to really support the community in that way. So that's fantastic. And just like Juliet and Brandy's success story, I feel like this, it's starting to catch fire in a good way. So, and expand and grow. Thanks for sharing. All right. Oh, nothing's off topic, Lindsay. So you have a producer interested in getting set up to accept SNAP benefits and would also be interested in enrolling in Double Up Food Bucks through OFMA in Harney County, but says that the cost of EBT equipment is prohibitive. Anyone have contact information or can point me in the right direction to help refer on this situation? Have you already talked with OFMA about that? Okay, Amanda, I'll send you her information, Lindsay. Yeah, they do TA for Double Up Food Bucks and for SNAP, accepting SNAP. And there is some, I think there should still be some free equipment through the state of Oregon for that, if you haven't explored that yet. Okay, cool. Amanda, I'm forgetting Amanda's last name, but from OFMA is the one who does the technical assistance for that. Yeah.
Can I do a off topic? Okay, so this is like hyper logistical, but I just, because a lot of the people in this room right now, this is relevant to, I'm just going to take the opportunity to plug that we are wanting to do enrollment a couple of weeks early this year, which means mid-March. And so it's that time to review our pre-survey. And I'm wondering if Shin and Kaylee and Carla and Meira and maybe Lindsay and Claire and whoever else, hey, shoot, wants to join in on just a review sesh of our current pre-survey. And the idea is that we are all using as close to the same survey as possible, right? So we can look at, get the same, outcomes. So, yeah, I like February, like later this month or like very early March would be ideal because we need to have our surveys complete and final and sent to our clinics by like the second week of March. So just want to put that out there. Does anyone want to help coordinate that? Yeah, Shin, go ahead.
Yeah, why don't I set up a when is good poll for the last couple of weeks of February into the first week of March, and then I'll get that sent out as well.
Thank you so much, Shin.
And then one last kind of shout out and action item for folks is Emily Carlson is doing her practical experience with us right now, and she is a Master's of Public Health student at OHSU PSU, and she sent out a Google sheet in the last couple of weeks for program operators to fill out, because what she's helping us do is create an updated census of the GRX programs in Oregon, and my Google Home is talking to me. So I will drop that in the chat as well, but we'll also send that through email. If you haven't filled that out yet or know of other programs that maybe aren't necessarily as active with us in this group, please share that information out. Does anyone else have anything to share?
Well, thank you everybody for being on today. And we just really, really appreciate all the engagement and excitement. And we hope that we'll see you on March 3rd too for the mini convening, and we'll dive even deeper into these topics. Not necessarily, you can bring unrelated topics too. All topics are welcome around Veggie RX. So we hope to see you there.
This is great. Thank you all so much.
Thanks everyone. Have a great weekend.
Thank you.